On this Valentine's Day, why not take care of your heart?
Yes, Craig, you know, yesterday we talked about the way to find your one true love is to love yourself. A way to love yourself is to take care of your heart. We have Dr. Michael Barber here with us. He is a cardiologist with over 40 years experience. He's also the medical director over at Strata. Thank you for being here with us today.
My pleasure, Julie.
40 years. You know the heart inside and out, quite literally at this point.
I think so.
February, of course, not only the host of Valentine's Day, it's also Heart Health Awareness Month, which is pretty exciting, you know. Walk us through some of the heart health tips that you have, because I know there was 4 we talked about prior to coming on air this morning.
I think it's very important for people to recognize what can cause heart or cardiovascular disease. The groundwork for that is a good diet to avoid heart disease. Nutrition is important, as is exercise, watching your weight. And people don't take enough interest in what we call knowing your numbers. What's your cholesterol? What's your blood pressure? What are you?
Cholesterol, knowing your numbers, cholesterol, blood pressure, all those things are good to know. Yes. I'll go to the doctor and they'll tell me like my blood pressure and I'll be like, I don't know what that means. What does it mean, your blood pressure?
Yeah, blood pressure is obviously a measure of what's going on inside your cardiovascular system. Generally considered 120 over 80 is the peak. It used to be that was considered to be the normal. They've changed the regulations now and the recommendations. And blood pressure of 120 over 80 is a great target for just about anyone.
And you were telling me the 4th tip that you have is to avoid excess alcohol.
Yes, that's controversial, as you and I were talking about. I think generally speaking, from a heart standpoint, a single alcoholic drink per day for females and 1.5 or 2, thank God, for males.
You get a little extra.
We get a little bit, we get a little extra, so that's okay. That's the way it should be. It's generally considered to be good for your heart. Excess of anything is bad.
And you were saying, like, you can't stock up and say, oh, I didn't have any wine this week, so I can have 6 glasses tonight. No, you can't do that.
Binge drinking is harder on you than actually just higher alcohol intake daily.
Yeah, anytime, if I have like 1 glass of wine, the next day I'm like, oh, struggling as a lady in her mid-30s. Are you starting to see more heart issues among younger demographics?
Absolutely. It's interesting. I think that smoking has gone down, or had gone down. Actually, younger people are starting to smoke again. We didn't talk about that, but that is a tremendous risk factor for heart disease.
Is it vaping or like cigarettes?
Yes.
Both.
Both.
Yeah.
Vaping, though, being, I think people feel they can get away with it because you're not smoking a cigarette. Just as much damage with vaping as there is with smoking cigarettes. Okay,
watch out. Don't smoke is what I'm hearing at all.
There you go.
So, I know that vaping became kind of popularized and pitched as this healthier alternative, but in the time that that's happened, we've seen all sorts of health issues, and of course the heart being one of the organs impacted.
All you have to do is sit behind a car where somebody's vaping and they roll their window down and the smoke comes rolling out. It's like having been in a bar on a Friday night.
It's like blinding almost.
Yes,
I've seen some of those vapors come out.
It is.
Okay, are there any symptoms that people need to watch out for when it comes to their heart health that could potentially be signs of heart disease?
Sure. Classic symptoms obviously are chest pain, usually considered to be centrally in the chest. But when you're doing routine types of activities, if you never got short of breath while doing that, or you never had any sort of nausea or feeling of the sensation of sweating, that can be a sensation of oncoming heart disease. And women, interestingly, men present predominantly with chest pain. Only about 30 to 40% of women present with classic, it's called angina, anginal type chest discomfort. And that's why women get blown off in ERs.
What are their symptoms?
It can really vary, as you were doing.
I know, I did the shoulder thing.
Yeah, am I giving you chest pain already here? Okay. No, obviously, jaw pain, neck pain, shoulder pain. Classic is pain in the center of the chest and radiating down the left arm. But women can be very different. Shortness of breath, and all sorts of different things. So you just need to take changes, in my opinion, seriously.
Okay, keep an eye on it, and of course you can get a full workup, I should say, over at Strata. We'll pull up that information for you right there. Just give them a call and they'll help you out. Dr. Barber, of course, the medical director over there. Thank you for being here with us.
Appreciate it. Thank you for your time.
Okay, from learning to love yourself to finding the right dress for when you find the one, Abby is standing by.